Hello, my name's Julie McCrossin, and welcome to this series of conversations with people who are working to improve access to clinical trials for everyone in our community. And this series is hosted by the GI Cancer Institute. In this episode, Dr. Sabe Sabesan, Director of Medical Oncology at Townsville Cancer Centre in Queensland, discusses what he calls the massive disparity in access to clinical trials and how cultural change, as well as the teletrial model, can make a big positive difference. The Australasian Gastrointestinal Trials Group are really committed to improving equity and diversity for your patients to get better access to clinical trials. Do you think the teletrial program is one of the key ways that will be achieved in Australia?
At the moment, we have massive disparity in access to trials across the country. The teletrial model is proven to be feasible, and it's been published on safety and efficacy. And that's why the Commonwealth actually gave that money to roll it out across the country and make a difference to all Australians.
Why is it important to include rural, remote, regional and First Nations people?
Rural, regional, remote and Indigenous communities, actually nearly 1/3 of Australian population. And we know clinical trial participation improve outcomes. And if there is lack of access and if there is disparity in equity, then that needs to be fixed. And that's why the teletrial program will act as a solution to fix a 100-year-old problem for whole of Australia.
Why is workplace culture important to making sure clinical trial health clinicians take up the teletrial model? Why does workplace culture require attention?
The workplace culture determines how we live our purposes. And one of our purposes is actually providing equitable access to all Australians, that including clinical trials. So if we have problem with clinical trial access, then it is a culture that needs to improve so that all layers of the system believes in clinical trials, believe in closing the gap, and then start acting to enable every layer so that the front line can deliver the trials close to home. That's why I'm passionate about workplace culture.